So welcome to Digital Pharma Unlocked. As a lot of you, I hope know, we're a community that was set up to talk about topics that aren't always talked about in our industry, that topics that maybe larger venues or larger commercial meetings don't want to touch on or dwell on. So we've covered everything from what the, excuse my language, what the F is omni-channel, and is it something that pharma can ever do? Is this the end of the pharmaceutical rep, and many others? So I think we're on our 8th or 9th meeting. We have 1,500 members, and as we like to say, or I try and say, that we are deliberately daring, deliberately honest, and deliberately free. And I hope this topic reflects that. And in fact, it was the last in-person event that we did, which was To Sell or Not to Sell. Has pharma become too precious to promote? That a member of the audience, I believe at MSL, in the live audience, asked, how should we engage as an industry with digital opinion leaders? And if we do, is it the end of the KOL? What does this mean for traditional KOLs? And I thought, and by the way, if you're in the audience now, please do flag that was you who asked the question. I'd love to put you on mic to explain or to comment on this. So to please either ask a question or flag it in chat. But I really engaged with that topic. Now, I'm not an expert and I don't really have a lot of skin in the game when it comes to key opinion leaders and digital opinion leaders, but I thought it sounded like a great topic. And then coincidentally, I saw Asmain present at the Code Clarity at Rena Newton's event not long after, and it kind of came together and I thought this would be great. And so I reached out to Asmain and to Felix and Yassine and Nadia, and here we are. So on that note, I'm going to ask each of the panelists to introduce themselves and say how they intersect with this topic, this problem, this opportunity, and then we'll go from there. And as I say again, please do put your questions in the Q&A and I will open it up for you to ask them. But without too much further ado, Marja.
Thank you. And I love the fact that an MSL actually initiated this meeting. So thank you, just in case you're participating today. My name is Maya Balman-Schramm, and I come with 24 years of pharma experience in sales and marketing, but more importantly in medical affairs and medical science liaison, hence MSLs. And the latter is what I'm specialized in. I've worked with MSLs at a country level, a regional level, and it's also been in a global field excellence role. And really what drives me thinking about actually exactly the topic is where and how should MSLs prioritize in the future? So anything I'm going to comment on today is coming from this MSL perspective and through an MSL lens, just for clarity, so you know. And there will be, up until now, maybe I change my opinion in about an hour from now. Up until now, I believe there will be a change in the way that we are speaking with physicians. And a shift, and I'm trying to figure out what exactly the shift is and where MSL should put their focus on.
Great, Maya. I think I was next then. So nice to see so many people. I'm Yassine. I work for an Italian pharmaceutical company, but I deliberately don't disclose where I work because if it's not obvious enough, all the words coming through my mouth are my own opinions and views. So to avoid that, that's the only reason why I'm not disclosing that. I work in a customer engagement / omni-channel type of role. I do a lot of congresses as well. That's really a big focus of mine, a very big channel, a very expensive channel. And that's where I deal the most with KOLs and then them especially being on stage. I find the topic of KOLs versus DOLs actually a quite funny one because I see the fact that we're looking at DOLs to a certain extent us trying to find someone to fill in the gap for our shortcomings. So for a few years now as a pharma, we're struggling to really break through digitally. And then we have some people who are more talented than us to interact digitally, like Asmain, like with really snappy videos that he does, for example, even on LinkedIn or his other channels. And then we're like, oh, please save us. Now you will be the bearer of our messaging all of a sudden. So I'm also happy to have the different perspectives here. And Felix, I think yours will be very valuable, and I'm handing over to you.
Thanks. So I'm a doctor by background. I worked clinically for about 5 years in the NHS. So that's quite interesting because we're talking about predominantly doctors, or there's lots of other types of influencers and opinion leaders, I think pharma is most interested in people who prescribe their medicines, which is probably a debate in itself. And also, as medical director of MedDigital, we work with a lot of companies, helping them do digital activities, social media, etc. And so we end up working with quite a lot of professionals, both providing insight and content, helping us with the content, but also actually working with them as speakers, you know, on online events and in-person events. So we're doing the kind of KOL or KE engagement and looking at how pharma companies should be working correctly with companies. So it's going to be very interesting to chat to the team here today. And handing over to Asmain.
Thank you so much, guys. So I'm Asmain on social media. I go by Dr. Asmain. So I started properly creating health education content around 4 years ago, during the COVID outbreak, when I realized there's a surge of health misinformation online. And since then, things have kind of spiraled out of control, and I've got approximately 400,000 global followers, many of them healthcare students and healthcare professionals, but also the general public, and speaking about, you know, some public health related topics. Some have gone viral, such as regarding the polio outbreak, or how to handle a heat wave. But my other kind of viral format is more targeted towards healthcare professionals, which are my medical quizzes. And so I am a complete outsider to the pharmaceutical industry, apart from events like this, where I cross paths with incredibly inspiring people. But my aim is to see how I can help revitalize the comms strategy and to kind of push forward the message that, you know, KOLs, DOLs, EEs, whoever we are, wherever we work, all of us are human beings with limited attention spans, and we can all try to be more interesting and engaging when reaching out with our messaging.
Thank you, everyone. And that's a really interesting point, and something I should qualify. I think it's fairly clear the importance of DOLs in communicating out to the public health information, health advice. But for the purpose of this discussion, I'd like to think about the influence within peer-to-peer, so HCP to HCP, because that's traditionally where we've used KOLs, and it's where I'm really interested in understanding and challenging whether DOLs can play a role in that. But before we do, what do we mean by, I mean, we love our TLAs in pharma. We've got KOLs and DOLs and EEs and all the rest of it. So I don't know which of you, who we can agree on what we mean by a key opinion leader, an external expert, a digital opinion leader. Are they different things?
Great question. So in my opinion, they are different things. There's huge overlap. People can be many of those. My preferred term is key external expert, because it reminds us why we're using them, you know, why we're working with them, using them as speakers or working with them to get insight in their opinions back. It's because they've got expertise that we need. And I think of expertise very broadly. I mean, I think you could be a patient or somebody working in a patient group. You could be all sorts of different things and have expertise. KE tends to be used only for doctors and prescribers, but I don't think it should be. I think it should be used more broadly. But KOL, I believe, is a kind of more industry agnostic term. It comes from in retail and elsewhere uses it. It is used elsewhere, and I think it was originally the first term that came in. So it seems to have stuck. But that, for me, reminds us that the one reason why we use them, but not the main reason, which is to influence opinion. And that's still part of the relationship. It's about us having a good relationship with them, where they can maybe influence in a positive way how patients are treated with our medicines. But it isn't just that. There's so much more. And I think that's why the KOL term is limited. And DOL, I think, is really interesting. It's kind of, for me, it's a subset of KOL or KE. It's people who've got a specific expertise in digital, and they can be a traditional expert, maybe talking at conferences. but they've got specific expertise where they can also influence online and digitally, which gives it kind of a special subset. And I think that's a really important subset now and even more so in the future.
If I may there, Felix, because that's a very interesting, very good summary. But one specific aspect of the KOLs, the traditional KOLs then as well, is the fact that we do our investigations with them, that they also publish with us, so that they are an impartial voice, really independently. We bring them in for that specific expertise. And for me, that's a very big nuance between the DOL and the KOL, because the KOL is really then a primary investigator or someone helping us to contextualize the science that we bring to them, while a DOL, at least with the definition that I give to it, is someone that can bring that science to others. So that's really an important nuance. For now, I have never seen a DOL really being an investigator on a paper. I would love to see that someday. But for now, I think that's really one of the big differentiators between that maybe Asmain, you have a different experience. Maybe you're already working on papers that you cannot say too much about. Do enlighten us, please.
So that's interesting. If we're saying, thank you. If you're saying difference that you see is that both a digital opinion leader and a traditional KOL, they're building opinions, and the influence is in a positive way. That's what we all hope. So it's about sharing data and having people understand data, right? But to your point, where are those people coming from? A digital opinion leader, often enough, as far as I know, they can actually evolve rather quickly. They come with some very good skills, communication skills, and digital affinity. So it's actually very democratic. If you have a good background, if you can communicate well, and if you have some digital skills, you can become a digital opinion leader. Versus the traditional KOL, they actually have to go through quite a process. They have to be writing papers, exactly as you just said, Justin. Writing papers, speaker engagements, being an investigator. So that takes a long time to get to this, let's say, position or acceptance by other physicians. And I see a huge difference there. And they often tend to be in the healthcare system for way longer than digital opinion leaders. So that's my difference. However, in the end, they are both informing their colleagues about scientific data. And that's the commonality I see. And that's the important aspect that we focus on.
Asmain, I hope you're okay with me sharing this because you've shared it on stage, but you're relatively young, right? In terms of when we talk, I think 26, 27, is that right?
28, just about.
28, just about. Okay. So to that point, key opinion leaders often have fought their way up and published their way up, and we all know that peer review can be merciless, etc., and they've reached that. And as you say, things went from COVID to things getting, I think you said, snowballed or out of control, or one of the two, and you've now got 400,000 people that listen to you on a regular basis. What's your view on, and I don't want this to be pejorative, but do you think you can be taken seriously with that in mind, compared to someone that has published so much, etc.? Or are we talking about separate skill sets, and the respect should be about how you deliver, not what you've done?
I'm going to come out and say it. I don't think KOLs will ever die or replace DOLs, and I completely agree that DOLs and KOLs are like in the same kind of Venn diagram that there are some KOLs who are DOLs, and there are DOLs who would become KOLs. And I would hope that, someone who is like me, relatively early on in my career, I very quickly developed an audience through the skills that I have in terms of communication, in terms of graphic design, in terms of scripting, and with the basis being my medical degree and my clinical expertise. That's not going to replace someone who, an expert who has been researching a particular specialty for 20, 30 years of their life. It's just not. However, when my role comes in right here and right now, is that given the audience that I've built, I can convey the message in simple jargon-free terms to the hundreds of thousands of people that follow me to actually have impact, to actually raise awareness that this is an important topic that they need to know about, to signpost them towards the papers and materials that they should go and read up on if they're interested to learn more. And I think that's where the strength of digital opinion like leaders like myself lies. That says, I am currently pursuing a master's degree in medical education. I hope perhaps at some point to do a PhD in public health. So, as the years pass, it may be that I become a KOL within that particular space, and my other branches of expertise all inform that broader purpose. But to put it bluntly, KOLs aren't going to die. KOLs and DOLs really ought to be working hand in hand to amplify the messaging that we want to provide.
And I'm glad you said that. I was wondering how long it would take for that to come out. I think as a lot of you know, with the DPU, the Digital Pharma Unlocked, we often pick a topic and then you've got to create a bit of controversy to create some interest. But I don't think anyone out there is going to say that an investigator isn't going to become a key opinion leader, and there aren't formats and forums where that long form death by slide deck might not be appropriate. But I want to pick up on this, which is, and Asben, you mentioned it earlier, and it's certainly come up in our discussions, which is, I think, and I feel that sometimes our industry, the pharma industry, puts HCPs up on a pedestal and kind of thinks and don't see them as human beings in the sense of they don't reflect how they like. I like short form. I'm not a social media user, but I do like short form and education that's enjoyable. And yet we do kind of load our HCPs with 30 slide slide decks of really dense information. We do always fall back to, and maybe I can speak to you, Yassine, about this, that, congresses, and it's always long presentations. And it really speaks to, do we think older generational HCPs don't want to consume information in the way that Asmin produces and delivers it?
So I'm just going to, before we answer that question about the format of the information, can I just jump back and just disagree nicely and be controversial?
Yeah, please.
So I'll just explain my thinking here. So as conferences get more savvy and they understand the reach they get through social media, they're going to platform DOLs. They're going to stick them up on stage to speak. And in time, the people who are influencing on TikTok and X, Instagram, etc., will be getting stage time at the major conferences, because they'll tweet about it or share it, and it'll go out wider. And conferences ultimately need to make money. So I think actually in the future, KOLs and DOLs will have to be the same thing. So even if you're the kind of academic type who's done a lot of investigations and academic papers and research studies, you're going to need to learn how to do social media. And if you can do both, you're much more likely to be successful and become somebody up on stage at the big conferences. So I think, I don't think, yeah, sorry, yeah.
I don't think that's I don't think that's as challenging quite what we said there, because we've seen that journey before. I'm old enough and grey enough to have seen this journey when it came to, and Yassine, you made these points as we discussed this before, that an investigator doesn't make a great presenter, right? An investigator is there because they've got the patients or the research background or the center or whatever it might be, but they might not be the right person to put up on the stage because they present awfully, and it can all be undermined by someone droning on and reading every word on a slide. So we've had people who are respected in their space, might not be an investigator, but are great at presenting. And in a way, it's an evolution of that we'd expect in time for them not just to be that, but also to be savvy in sharing that information. But in the meantime, maybe not in the meantime, there's also that And we can see the point, and Stefan's made a point in the chat about the funnel. And we may be going both ways, which is here's the research, let's broadcast it in meaningful, enjoyable way, but also maybe bringing people into the deeper information as well. So I don't speak to that at all. But Asmain, what's your view on we're thinking of DOLs really in your space at the moment, which is social media, etc. But there's also the more closed environments, the closed medical socials, LinkedIn, etc. What's your experience across those, and what's your exposure to other DOLs that may be more leaning towards the scientific peer-to-peer element?
Well, in my limited experience, I wouldn't say what Felix has said is very controversial at all, because I completely agree that I am trying to push clinicians, fellow clinicians, especially senior clinicians who have an abundance of clinical experience, to give social media a shot, because they have so much value and expertise to provide to a potential audience of thousands or millions that they're missing out, and the people who would benefit from that information are missing out. So I would actually say that it's very difficult in today's world, because we have to be skilled at so many different things in a way that we didn't have to before the world was entirely online. But I think that more and more those digital skills, as well as those communication skills, are going to play a bigger and bigger role in determining who gets heard, essentially. Because if we think of Twitter or X or whatever, you have 140 or however many blooming characters but people build huge audiences off of that, especially in the scientific space. That's apart from LinkedIn, that's primarily where the DOLs within the scientific space kind of began. So that's the power of just words alone. And we know that the ability to present and speak and capture people's attention is really, really important. So if you have the skills of, the scientific research skills, the basic science skills, and you have marketing skills, and you have communication skills, if you have someone who is adept at all of those different skills, if they're stacking those skills together, they're much more likely to end up in front of an audience and be able to convey what research they're doing and the importance of it.
But if I may there, actually that's already a lot of skills, and that's where I don't necessarily agree with you, Felix, that in the end every KOL should become a DOL, because like you refer to, if you want to be a DOL, or if you want to have an online presence and captivate your audience, we know that if you're in a symposium room, people are forced to listen to you, but if you're online, after 5 seconds, I can drop off. But as you said, the skills that come with that are scripting, engaging scripting, editing, storytelling, and in all honesty, you would be surprised in how many meetings I still am where we say in 2024, maybe we should give our KOL some speaker training. So if we're already just lagging in being able to find decent speakers that can captivate an audience with people that are sitting there for 1 hour by their choice, and we still need to train them on basic things like public speaking, then I don't think that we will be able to train them in all of the other skill sets that are needed for DOL. But I would go even a step further, and I know I will get some bullets from the medical teams here, but I don't even believe that that mindset sits within medical teams. Because if I look at what sometimes the medical side of agencies deliver, the videos that they deliver, again, they're very focused on the science, but not on the engagement. And they're not focusing on keeping audiences engaged. And I still am in fights where we're trying to deliver a 1.5 hour symposium, put it online, and then pray that people will watch it without a push strategy. But like you said, James, maybe why not cut it into pieces, make it to a short, but then you have the chance from compliance. Yeah, but what about your balance between safety and efficacy? So there's a lot of considerations to take into account, but where there's a will, there's a way. So I'm sure we can get there, but we need to pave that way for ourselves within the industry as well, rather than just rely on DOLs who have that skill set internally. So we also need to develop those skills internally. And then maybe Maya, it would be interesting to have your point of view, maybe more from medical MSL side, and maybe you will shoot me down now because of what I said about medical needing to skill up.
Actually, I'm absolutely agreement with you. And there is this sense of we've always been doing it. Why would we change? And the interesting thing is the physicians don't ask us to change. They just come along. And that I'm finding still surprising. Why would a physician not saying, you know what, I'm tired of listening to you guys, the way that you're presenting. And actually, a 30-slide slide deck isn't that bad at all, James, right? I mean, I've seen longer. So yeah, so to this point, it's like we've always been doing it like this. And someone wrote something about a funnel in the chat, and I think that's part of it. It's like capture interest in this short format. As a key opinion leader and as a specialist, you will have to dive in the details, right? You have to read the publications just because it's part of your job, basically, to know all the data in detail, and physicians go in great detail sometimes. However, there's a time for all of this. And in terms of capturing HCP's attention, or actually, getting their attention, I think we are better off with the short version of data presented nicely, interactively, and there's still room for the deep dive. But medical has become a bit lazy because no one is disagreeing with us. We're just presenting those slides and physicians sitting there and just watching, and yeah, and that's it. Why?
To be fair to medical, I have to agree. It's a stereotype that's been earned to a degree, but I will say that the more recent engagement I have with medical teams is the idea of storytelling is top of mind. Like, how can we tell this science better? And maybe even learning from commercial, and dare I say, I think there's a lot to learn from DOLs like Asmin, and how you engage such a large audience and how you can do it. But there's the old elephant in the room right now, which it wouldn't be a webinar in pharma if we didn't have to address compliance. So we've had several chats in the comments in there. Can we just get a reminder, Felix? What are the big, I want to call them issues? What's the considerations around engaging someone with a public profile, or engaging someone on social in general? It's where I think pharma gets most nervous, right? And you see some of the more obvious issues.
Yeah, it's a great question. It's where people kind of panic because they don't, it doesn't say DOL in the ABPI code or any of the regulations, so therefore people fall over and don't know what to do. But actually, I think if you categorize people you're working with in 3 essential different categories in this area, the first is as a speaker. You pay them, you control their content, you sign it off, you approve it, etc., and they speak on your behalf with words you've approved for them to speak with. And that's a very clear relationship. They can state they've been paid by you. The second one is as a kind of journalist or a kind of blogger. You might have an expert blogger where you're providing them with a press release. There may be not quite traditional relationship where they are literally a journalist working for a newspaper or a journal. You hand them, they might be a blogger and very influential line, but you can still give them kind of arm's length content and they can review that. They then make their own editorial decision and share that as they feel fit. You're not paying for them, you're not controlling them. And the third category, I think, is where you work with them to improve your own communications. So you use them as a digital advisory board, or do market research, or you work with them as a contractor, as a consultant who's advising specifically on our activities. So although they're not speaking externally on your behalf, you're using them to improve what you do. And that area, we've worked an enormous amount with DOLs because they're experts, and pharma companies need to learn from them and learn how to do it better. And if you kind of fit them into each of those buckets, the rules become very clear, because the speaker you're paying, the journalist your arm's length and giving them a kind of press release or equivalent, which they then make their own decisions on. and the kind of insight comes from that expert where you're paying them, but they're not sharing or talking on your behalf externally. So then you can kind of get ahead with it. Do you know what I mean?
Thank you. And I really think it's interesting going back to what you said earlier about opinion leader, which really, are we leading opinion? Should we be leading opinion? Opinion is subjective, right? Whereas we're talking about scientific communication. So when you talk about experts, and you said something I hadn't considered before, because I'm very traditional and because it's a long time since I've worked with KOLs, is that you don't have to be an HCP to an expert, and you maybe don't have to be a deep expert in one particular therapy or research area to be an expert. You know, you could say that Asmin is an expert, or I'm sure not just could say, I would say Asmin's an expert at communication. So there's a lot of discussion in the chat around this KOL, DOL split, etc. But Asmin, I know that you're working, or increasingly engaging with pharma. Have you had any direct engagements? Obviously, you don't have to name the company or anything like that, but is that, and I know you're incredibly well connected with other DOLs, which I know because since I've said that I was going to be working with you, my LinkedIn inbox has been filled with medical students, young doctors, influencers, etc., in a very positive way, which is great. But what do you see? How are you seeing this engagement between pharma and DOLs?
I think it's just getting started. It's the very early nascent stage where there's still a bit of hesitancy from what I've seen in terms of the discussions. And I think it's still a lot about trust and figuring out whether we can trust each other, basically. So how do I see it going forward? I've done, well, a paid collaboration with a pharmaceutical company in order to talk about a particular health topic with a kind of public health messaging style. So obviously we are not allowed to promote medications whatsoever, but kind of creating user-generated content whereby using my communication skills, I was able to portray the message that the brand wants to convey. That's a possible way of going forward. But me personally, my mission, especially as I'm building health media consultancy, is to work directly with the communications leads at pharmaceutical companies, essentially, to figure out how we can improve communications towards both HCPs and patients. Given this panel's focus, I'm going to focus on HCPs because you know, I can't say too much. I was having a meeting yesterday. There's a fantastic kind of medical education startup. I can't give away too much in terms of what they're doing, but they're looking to work with pharma as well in order to educate healthcare professionals. And I think that the way that I produce my videos, kind of short form content, easily digestible, I think that's going to be the way forward. And I think that more and more we will see pharma change its ways to create content, well, a separate line of content that's focused on HCP education, where it's kind of short form, engaging, visual videos, images, quizzes, that kind of thing. And that's not to say that the, you know, the clinical trial papers or white papers or whatever, you know, marketing emails won't matter. It's just going to be a better way to engage the HCPs, to grab their attention in the first instance with the limited time they have. And then if they are interested in learning more about the methodology, the side effects, etc., then you can funnel them towards the other material, essentially. I think that that's how it's going to work, and I think that more and more there's going to be usage of DOLs like myself to get the message across, put simply, in order to just get eyes on the content, and then from there on there will hopefully be more kind of conversion to the material that pharma wants to convey to the HCP target audience.
Great, thank you. So sort of bringing people in to learn more and maybe handing off. So investigators and KOLs creating the science, communicating it out, and then bringing it back to long form. So Yassine, Maya, Felix, any of you, do you have experience working with DOL success stories, maybe not so successful stories? And then I've got a killer question from Amish. That if just be prepared, Amish. I know you've got a great mic set up at home, so I'm going to ask you to answer that live, if that's right, in a second. But any experience from the rest of the panel in working with DOLs in pharma?
So, if I may, I have limited experience, but before getting to that, I just want to say that the way I see all of this happening is only in the launch phase because of compliance. So, in a launch phase, you can speak about burden of disease awareness, quality of life, and really educate the population to make them the best or the most informed prescription decision possible. But after that, really communicating on, for example, a real-world evidence study through a DOL seems very complicated to me, but where there's a will, there's a way, so maybe one day we'll get there. When it comes to DOLs, actually, there's one experience where I myself have tried, and actually we didn't get past that trying phase because of the compliance rules and burdens. It was a UK-based HCP, and what we were asking was actually not something that seemed overly complicated. But then, of course, ABPI code, interpretation of disguised promotion, even just speaking about the symposium, where the person was speaking, for example, asking to do a tweet, no, because ABPI code forbids that because it's disguised promotion. But then I do know in a country that we operate in, but I was not directly involved, they did use GPs to educate other GPs, and they also launched recruitment then for a MEDET program. And there it was extremely successful because peer-to-peer, GPs speaking to GPs, one of them vulgarizing, explaining also the benefits of being in that program. And that was hugely successful. And they were able to do a webinar with, I exaggerate, not close to 1,000 attendees, because this was really peer-to-peer. The source of information was a very trusted then DOL within that country. So it is possible, but again, depending then on the country the DOL operates in, because that has a huge influence, because even though a DOL can have international or global influence, he or she still remains a national HCP and thus is bound by the national rules. And that's the big challenge that we will have if we want to collaborate with them. At least that's my point of view. I saw Felix nodding, so I don't know, Felix, there, if you want to agree or disagree.
Yeah, no, I agree. I think those are really great examples of where it's successful. With regards, our successes, we've worked a lot with digital opinion leaders to give insight to companies to improve their activities, as I mentioned, through digital advisory boards or market research and consultancy, where they just work directly. That's great, and it really helps companies to see how it works through an expert's eyes. Second area is in disease awareness. Worked a lot with people who are working in a disease. They might have the disease, very influential. So not about products, not product promotion, as Yassine mentioned. You mustn't do that under, most country codes mustn't promote medicines. So what you're doing is you're getting people who might have the disease or might have symptoms to go and see their doctor. And that could be hugely beneficial working with somebody who's a digital opinion leader. They might have massive following, they might have huge authority, and you can go in with really support them to create really excellent content and get them to do that. But again, so that's the kind of non-HCP stuff. The HCP stuff we're doing is things like medical education, where you're getting digital opinion leaders to come in and do talks. Because it's often product related or pointing towards a product, it's difficult to do that publicly, but you can do closed meetings where you've got these really good communicators in doing really great talks. You then chop them up and stick them online, perhaps behind password or in a professional portal somewhere. So you can create really high quality content with these people who are very, very good at communicating. And those, I guess, would be the three big categories we're working in. It gets much harder if you're dealing with marketing and promotion, because how do you work with these speakers? But you still can. They can do promotional talks and promotional speaking engagements.
I have not met an MSL yet who was allowed to work with a DOL, unfortunately, for compliance reasons. And the thing still that I expect from MSLs, if they're working with physicians and either they're being in touch with a true DOL or a KOL who's very open to digital communication, the one thing that's important to me is that those people have a good basis for whatever they are communicating, meaning I want them to make sure that they have all the data they are required in case they're discussing the disease area that I'm working. This is my minimal goal, especially with those people who are being like very digitally active, even though they might not necessarily be called a DOL at this stage.
And hold that thought, because George Lellis, I don't think I know, has put a question, well, not quite, has made a comment in the chat I'd like to come back to after Amish's question, which is around quality control and etc. I'll come back to that one. But Amish, if I allow you to talk, are you there? I'm going to ask you to unmute. Are you there?
Hello, yes.
Hey, I can.
Nice, perfect. Shall I shoot with the question?
Please.
Nice. Okay. So yeah, it's back to the topic around kind of DOL audiences, and I was thinking how they're built on authenticity, and you're kind of nurturing that relationship over quite a long time. I think you said 4 years or so. So is there a fear that from DOLs or yourself specifically, Dr. Asman, like if you're doing pharma-sponsored user-generated content, could that turn your audiences off and everything you've built potentially goes the other way?
That's a very interesting and a very difficult question to answer, because I am very passionate that physicians and pharma can be working more closely together, especially physician DOLs, within the realm of public health messaging. And I think that's a great way to, improve the reputation of big pharma, but actually have a tangible impact on health outcomes as well. Because as far as I'm concerned, social media is a new social determinant of health. So I do know that there are colleagues of mine who are hesitant in direct and explicit collaborations with pharma. And I think that there are those who are more open. But from what I've seen, it's difficult because I think the narrative needs changing. The narrative is that, big pharma is out to get you. They'll take all your money and they don't care about your health at all. And it's kind of pitting physicians against pharma, and if a physician sides with pharma, then they are traitors somehow. I don't think that. I think the narrative needs changing, essentially, and I think the only way we are going to do that is by moving forwards. Instead of being afraid, we move forward with the collaborations, where pharma funds DOLs or major campaigns to improve public health. We show that it has impact. Having said that, measuring social impact with specific KPIs is a lot more difficult than just how much revenue you receive. But there is impact in terms of comments and views and what people's reaction is to that content. I think that it's, I mean, any of us as public figures, it's really all about politics. So if we can spin it in a way that that genuinely delivers, public good, then I think we can stand to change opinions and show that there is space and a future for collaborations like this that are going to be welcomed by people. And I think that if we don't at least give it a shot, then we're losing out on so much potential value. So I think that this is a challenge, and it's one that's not insurmountable, and it's one that's worth trying to resolve together.
I really appreciate what you said, and because you and I were both out at Pharma in Amsterdam, as was the other week, and we had a session on reputation. And I forget sometimes because I'm so involved in our industry, and I'm really proud of how ethical we are and how we are self-regulating. And actually, it's very hard to do anything wrong now these days. But we have to be honest that when you look backwards, it wasn't always that way. And there have been some things that we definitely shouldn't be proud of. And there may also be some current issues in certain markets and all the rest of it. But when I think about the efforts we go through right now to be upright and ethical, it's fascinating to me that perception of big bad pharma still kind of exists. And it almost illustrates why we need help from DOLs to communicate better, because we're not very good at communicating ourselves. But I don't know if anyone wants to speak to that point that Amish raised and Aswain answered.
I think if we do it in the right way, it builds our reputation, both DOLs and the industry, because we can collaborate and do things better for the right reasons. But if we do the wrong thing and we're trying to just focus on influencing and the kind of the wins for pharma as they might perceive it, it can go wrong and get misinterpreted. Whereas if we do it in the right way for patients and for doctors and for health professionals to help them do their job better, to get better, to get patients better, it's going to win, and we're going to improve our reputation for everybody.
Yes, and anything to add?
No, on this particular point, I don't necessarily have too much to add, so I'll pass on to Maya.
No. Okay. All right. So I'm going to. There's a related point here, and Maya made a point earlier about democratization. That is the social, and I think back to YouTube, and the analogy for me is that if you wanted to get a program made, you needed an awful lot of money, first of all, for the kit. Then you needed a producer. Then you needed someone in broadcasting to or an agent to get it. And there was all of these many checks and balances until, all of this thing that you might comes to this very narrow point of, can you get onto TV? Can you get onto satellite cable? All of that. And then YouTube comes along and it democratizes it and it removes all the middlemen, and you can literally, with a handheld camera, create content. And it has given us amazing content, but it's also given us disinformation, or not intentional disinformation, but something wrong. So I'm going to read this for George because he didn't ask in the Q&A, but the one shouting loudest from the roof does not mean that he or she is the most appropriate to shape health policy, let alone suggest a responsible diagnosis and treatment plan. A KOL can be digitally savvy, but DOLs should be a liaison to the KOL until we are mature enough to engage KOLs and DOLs simultaneously. So just wanted to briefly speak to the kind of quality control issue and disinformation, and how pharma, what if a DOL that we worked with goes on to do something else and we're associated? You know how pharma like to say we're responsible for everything once we engage with it? Just an open point to discuss.
Well, yeah, I mean, you don't need to spend long on Twitter, X, before you realize that shouting loud doesn't necessarily mean you know what you're talking about. And that is the problem. And that's where selecting the right people who understand the area, we are experts in our medicines. So we need to work with people who are also experts in their area, and we need to understand and be able to verify that and choose them correctly. As Yasin's commented on a couple of times, the codes and regulations apply to our activities in social media just as they do elsewhere. So if we're working with the DOL, we must make sure the content they're sharing, the partnership we have with them is appropriate, transparent, and based on really, really high quality outputs. But we can do that. It's not that difficult. It's not that. It's just as easy as working with a panel of speakers, you know, top experts, and rolling out a kind of med ed session, you know, a kind of day across the country, which companies have done comfortably for decades. Now we need to move that into the online space and do similar things with digital opinion leaders online, recognizing that it might be more kind of patient-led rather than a kind of healthcare professional if it's going to be talking about stuff in public social media.
Actually, we addressed a very complicated point there, because even though we would do our due diligence and make sure that on our side everything is done correctly, or on the DOL side, there's still a big danger that I see, which is the infamous algorithms. For example, a very famous example, in France, 9% of the population is flat earther. That's an obvious lie, even though sometimes it's just a divergence on point of views when it comes to some misinformation. But it's because you, by accident, watch one video and then you get sucked into an algorithm and you only see flat earth videos. So what is the role there that we need to play? Because if we put some of our content that is in high quality, compliant, etc., on a platform, but you get sucked into a nebulous dark magic algorithm that all of a sudden you need to cure cancer by killing rabbits. So there's very big ethical discussions to be had there, and things we also need to think about. But maybe that's even a step too far, but still something to keep in the back of our head, because I also saw a question about AI models. But then again, AI models are still created by individuals. They're still fed by knowledge articles. Who owns those knowledge articles? So there's really a big ethical question then that comes to this. Maybe I'm opening a kind of worms or of snakes, but that's also a consideration we need to take into account.
Well, I mean, I totally agree. We need to be really cognizant of how the algorithms work and what's going to happen to our content. But if we don't get out there with really high quality content that's truly accurate and unbiased and really is there to help patients, and you know, professionals do their job better and patients get the treatments they need, then who is? You know, we've got to help people like Asmain and other, you know, DOLs to do their job better. You know, help them, give them a production studio, give them access to experts they might not have access to, give them early releases of the data before the conference so they can prepare their talk at the conference and be ready for it. You know, so they've got that stuff we have at their fingertips to do their job even better, and we can then use that to try and get rid of some of the disinformation and really, you know, try and get those algorithms sharing some high quality content to people who need it.
I think it's a great point, and pharma's great at avoiding risk, but when you can be tempting to avoid risk, but when you do that, you end up not controlling. And I don't mean controlling in a negative way, but controlling the right narrative, as in being able to. And I can't remember where I was seeing this, but the idea, someone was talking about the fact that there were various Facebook pages out there for pharma, and like some pharma doesn't have them, and a lot of them were fake. There was like 16 different AstraZeneca ones, and all the rest. If we don't have if we don't turn up, we don't have a voice. And I'm very conscious of time. It's suddenly all lit up with questions and all the rest of it, which we're not going to have time to address now because we're coming up to the last few minutes. So what I'd like to do is, I'm going to find this very difficult to summarize, because we kind of did drift from peer-to-peer back into public health. And I certainly think in the public health and disease awareness space, there's huge opportunity. And I know there's already great work going on there. In terms of the peer-to-peer, we've identified some of the issues, some of the concerns. There wasn't an awful lot of great examples. I'd love for us, if we came back in a year's time, to actually see, I don't know if I can call you an influencer or not, or whether that's pejorative, but an educator like Asmain and pharma working together to educate peers. And maybe that's where Sermo and MedShare and closed social media might actually be a lot more productive in that space. That's something maybe to investigate. So I'm going to ask each of you in the last couple of minutes just to say maybe a closing thought, maybe a bit of advice to people in the audience about, if we want to engage with DOLs, if we want to optimize the relationship, what would you do? What should they be thinking about? What should they do tomorrow to start making that happen? And Maja, I'm going to go to you first because you're top left for me.
Yeah. So as I mentioned earlier, MSLs are currently not so involved with DOLs for compliance reasons. One thing I'd like to encourage those teams is start to set up a framework that you're able to engage. because this is happening, and as you said, it's better to be part of this game, part of the game, to control it in a positive way and manner, versus just being thrown back and forth from what's happening anywhere. And I'm still thinking, so currently, if a pharma company involves DOLs, it's usually the medical, if it's from medical, it's a medical manager, an in-house person. But that's just because there are only that few DOLs we're engaging with, like a handful, maybe, and because it's still seen as complex and new. But we have to make this the new normal. And then I'm still wondering how the MSLs are going to prioritize DOLs versus KOLs, but I think that's another topic. But start thinking about the process, get the process in place now.
Thank you. Yassine?
So I would say don't look at DOLs to solve the problems you have internally. Most companies don't even use LinkedIn because then it's a corporate channel and the brands don't have access to it, or the medical teams, etc. So look at DOLs to do the right thing. I had my idea of, for example, using them in the launch phase, but also to vulgarize certain aspects, but really solve the internal problems first. Try to then use the right channel at the right time for the right reason as well. And DOLs is not the Hail Mary that will save us for our internal shortcomings, unfortunately or fortunately, depending on how we look at it.
Thank you. And Felix?
So I'd get the corporate comms, the PR teams to expand the definition of journalist to include DOL. So when you release a press release, you also release a kind of DOL-centric press release. So it's not press release, a DOL release. And you write that non-promotional, informative, and you give that to DOLs as well, so that you include them in that definition. That will enable you to provide them with really high quality content, all the key issues that you're dealing with as a company, as brands, and they then will use that information to share with their following in a better way.
What is the, I don't want to get us down a rabbit hole, but what is the definition of a journalist? Surely it was someone who communicates to the public through a forum or a channel. You don't have to work for a newspaper to be a journalist, right?
You don't at all. And so therefore that's kind of the point, is that you don't have a badge that says, or a medical degree, a journalist degree that says you're a journalist. Some do, but some don't. And you can expand that definition to include digital people as well, bloggers, people on TikTok, etc. As we talked about.
Fascinating. And Asmain, your last thoughts?
Gosh, I'm not sure I have much more to add. But no, essentially, I feel positive about the future. And I think what Felix just said, that sounds like a perfect way. That is exactly what I would have proposed as well. That if DOLs like myself had delivered a briefing document for explaining the significance of a particular new piece of research or public health related matter, the same way that I'm doing with the World Health Organization or with NHS Digital, then I think that stands to be a really fruitful and impactful way that social media DOLs like myself and pharma can move forward. And, I'm always passionate about getting the message out to more people in a way that people can understand. That's as simple as the message gets. So if we can work together to improve public understanding and HCP understanding, that's the ultimate goal.
Thank you. And although I don't have a lot of skin in this game, there's two things that stand out for me from this conversation. One of which is HCPs are just like the rest of us, although two of you are HCPs, in that, we consume it's easier to consume information that's enjoyably presented and often shorter. So there's a lot that we can learn, and there's been a lot of questions in the chat around, should we be teaching this to clinicians as they graduate? But there's also a lot that we could learn internally at pharma. Yassine, to your point, we may be trying to fill our own lack of expertise by leaning out to DOLs. But for me, when we think about the journalists that we used to try and influence, still do, and send them press releases, actually, Asmain's audience is bigger probably than any of those journalists used to have. And if pharma doesn't work well and closely with educating and influence like Asmain, what a huge opportunity we're missing out to change. And I'd love to have dug into a point you made earlier about social being a determinant of health. But if we don't work together, we don't get on to this opportunity, then we're missing out on educating and helping hundreds of thousands of people that we wouldn't have been able to reach before. So on that note, thank you, Marja, thank you, Yasin, thank you, Felix, and thank you, Yasmin, and thank you for everyone that's joined us and asked the questions. So sorry we can get to all of it. Just a flag, for those of you who are London-based, DPU has a social gathering at the Fellows Pub in King's Cross on the 6th of February. It's free to come along. It's a great networking event. And then our next event, our webinar educational event, will be on the 19th of March around customer engagement excellence in name only. A much more sort of commercially focused pharma piece than this may have been. And more information will be published shortly on that. Thank you, everybody. Have an excellent evening and be safe.
Thanks, James.
See you, everybody.
Thanks, James. Thanks, everyone.